Hello, welcome to our clinic. Okay, is this your name? Very good. Okay, we're gonna be doing the complete face spa on you today, and also the facial analysis to see what are the requirements of your skin in particular. Now, I just see here that you fill up your concerns, which is mostly about how your skin feels. It says that it feels bumpy to the touch, also dry at times, very oily other times. Do you consider yourself mixed skin, which means a T-zone where this area tends to be more oily and the areas of the cheeks tend to be more dry, or is all over your face that you notice that it gets dry, it gets oily, but it's at quite random times? Okay. Are you on any treatment for your skin? Let's say creams, serums, anything like that? How about your skincare routine? Do you follow anything? Only face wash? Okay. How often do you do this routine? Every single night? Okay. So we are going to be inspecting your face. We're going to be doing this with bare hands so we can feel how your skin is on more deeper level. That as we do it with gloves, it's quite hard to have this sensation. Let me just start by disinfecting my hands. Do you feel any itchiness, burning sensation in your skin? Okay. Right. My skin and my hands have been disinfected. I'm gonna get close to you so I can inspect your skin, okay? It's gonna shine a light from here. Okay. Yes, it does feel rough. Yeah, I see what you're talking about, especially on these areas. It does feel quite rough to the touch. Forehead area too. Now I'm gonna get close, okay? I see a few bumps. It does require a deep cleaning. That is a must. As I can feel, it's all over your face, this sensation that is quite rough, almost like sandy, very, very tiny little bumps around. Could be clogged pores. Do you normally exfoliate your skin? Okay. What kind of cleanser do you use? Okay. Yeah, that one can be quite rough to the skin, so it's best not to use it. Especially if you use it daily, and even if you use it several times a day, it can cause those issues. But I don't believe it's just the cleanser that is creating this. be that your skin is just thirsty, that it requires some pampering. I would call it like a reset that we can do for your skin. So we get rid of the external layer of dead skin cells and unclog your pores, and that is going to help us a lot with this bumpy sandy sensation that you have. I don't believe it's an allergy or anything like that, like a reaction. No, it doesn't feel like that. If it was an allergic reaction in your skin, it will be itchy, it will be uncomfortable, and you will definitely notice there is something wrong. But since you don't have those symptoms, this is clearly an issue just that requires a deep cleanup, and that is gonna help a lot. Okay, now we're gonna do a test for the moisture levels on your skin. Okay, I'm gonna scrape your skin here. We normally will see a healthy level of oil, skin oil on this. Let's analyze it. We are 65%, that's way above average. Let's try this. Now this can feel a little bit warm to the touch. That is necessary for this test, okay? I want to see how strong your skin is and if it's candidate for the treatments that I'm going to suggest in a second, okay? I'm going to press, leave it for 5, 4, 3, 2, 1, okay? Again, 5, 4, 3, 2, 1, release. 5, 4, 3, 2, 1, release. Again, 5, 4, 3, 2, 1. Okay. Well, good news. Your skin is candidate for the treatments that I'm going to be suggesting in a second. Sometimes skin can break very easily during this test, meaning that it leaves marks, that it can cause breakage in the skin. In your case, it's all well, it's quite strong, so there is no issues with that. Now, I'm gonna do a serum test. Let's see if there is any allergic reactions towards that, okay? Just bring it up. If there is a reaction with this, it means that your skin is very prone to this kind of allergic reactions and could be difficult to treat it. But if there is no reaction, then we are able to use all the products that we need for your special needs on your skin. 1 second, please. Now this is gonna feel great. It's very silky and smooth. Okay. I'm gonna tap it in your skin. Normally reactions are quite fast. It does feel a little bit warm. That is normal. No issues there. Reactions will be that I notice that your skin starts getting a little bit red, a bit bumpy, and then you start feeling that you need to scratch. There we go. This is self-absorbed, so there's no need to remove it. But in case that there is a reaction, we can easily remove it. We're gonna wait a bit to see if there is any reaction. Okay, if you have itchiness, please let me know. Very important. But I don't see anything right now. Let me just start by prepping up what I feel that your skin is needing at the moment. Feels warm and it's quite silky once you apply it. Okay. Well, I do notice there is some swelling in your skin, so we're gonna be doing a wash and massage. It's gonna be great for that, to help the fluids flow in your face. Sometimes when we don't do exfoliation, we don't tend to massage our faces, and it's not something that it needs to be done every single day. Once per month is even enough for this kind of situation, especially with face swelling. This massage would be great for you. Dermaplaning too, to remove some of the pitch hairs that you have, and it's also gonna help with that sandy sensation that you feel. Gonna help it control it. But the main thing that we need to do is a face peel, which means it's gonna remove the first layer of your skin, the one that has most of the dead cells in the skin. This is not gonna leave your skin like the chemical peels, not at all, and it's not gonna be swollen or anything like that. It's just gonna remove the dead skin cells in your skin. We're gonna book you with 3 of our amazing skin consultants that are gonna do these treatments for you. I believe an hour and a half is what is needed for this. Do you have this time? Okay. Now, let me check your skin. I'm gonna shine that bright light again, sorry. Okay, looks good. No reaction, no redness present, no itchiness. Very good, no itchiness, that's great. So you have no allergic reactions to our products. Very well. So these treatments are gonna help you greatly with this. It's gonna leave your skin feeling like silk. Very, very soft. And at the end of your appointment, I'm gonna be giving you a skincare routine that is very, very easy to follow, with some products that you can purchase at any place, such as Walmart, Target, pharmacy, Rite Aid, any place. It's very easy to find. These products are especially suggested for your type of skin, your type of situation and issues that comes with your skin. So those are safe products that you can buy. And also a pamphlet on how to use them. This is our just 3 products, which is a cleanser, the one that you're using at the moment. Please just use it again in your skin. It's a cleanser, also a tonic that is going to help you feel refreshed, and also a night cream. very easy to use. It doesn't take more than 5 minutes or even less to do this skin routine. Okay, so if you can join me to this area, we're gonna start your first treatment, which is gonna be first the face swelling massage. This way. Hello, are you ready for your treatment today? And how are you doing? You missed your last week's session, I remember. Oh, really? I hope that you feel better this time. Well, you're here today for the facial swelling treatment. Have you been feeling a little bit puffy lately? Yeah, during the mornings. Yeah, that's mostly the times where we start getting puffy through the night. So let me just finish putting on my gloves, and I'm gonna be checking your beautiful face. At the moment, how are you feeling regarding the swelling in your face? More so? Okay. Have you had any changes in your diet? Maybe your salt intake has increased. You're eating something different, maybe more fries or fried food that can contribute to more salt intake into our bodies. Yeah, sometimes we don't even notice that we are taking more salt than we really require because it's hidden among the foods that we tend to eat. So we have to keep in check that, especially when we reach certain ages. We start feeling more and more puffy, and not only in our faces, could be on our hands, and our fingers, legs especially could be very troublesome. So very important to check that. Okay, very well. So okay, trying to do the pressing test to feel how is the water retention in your face. Okay, you're telling me that right now you don't feel the puffiness, right? Well, let me tell you, I'm pressing and it does feel a little bit puffy. But since you're telling me that it's normally during the day, in the mornings, that this occur, yeah, through the day we start flushing out the salt. So by midday we start feeling like normal again, and we start eating again the salts. Yeah, it does feel puffy, especially under your eyes, right here and on this area. So we're gonna be doing the lotion treatment along with the pressure one. We're gonna be using this tool right here. It's pretty cool, which is great for the puffiness. We can also work it at home with just a spoon that is being chilled in the fridge. It works great, but we use this. It's softer and the rounder corners feels better in the skin. So I'm gonna be using this jade stone, specially designed for the face, the contouring. And we are also gonna be using this serum. This is a moisturizer pearl eye serum for under your eyes, which is gonna be great for the puffiness in the area in particular. And for the rest of your face, I'm gonna be using this sea oil serum that works amazing to reduce the amount of water that is stuck in the area. So we're just gonna be flushing it down. Okay, works amazing and feels just as great. Okay, so I'm gonna start by cleaning your face as always. Very important to have a very clean face. And put in this to prevent the hair from falling down, okay? There we go. Just putting your hair to the back like that. Good. Very well. Let me start by doing a cleanse. Well, it depends on your diet. You have to, well, not keep a journal, but be mindful of what you're eating and try to find what is the cause of this puffiness, what changed in the past weeks that started getting you puffy, and all this swelling and water retention. It's definitely something to do with what you eat. And if after you are looking at what you are eating and you're not finding anything of concern, I will really suggest you to go to your medical practitioner for an examination, because there could be an underlying condition causing this. But most of the time is because what we are eating. Okay. Yeah, I tend to get pretty puffy too, especially because of how I eat. My favorite foods are Mexican food, of course, and it can be very salty. So I take water pills. It works great when I take in a lot of salt, depending on the foods. So I know that I'm gonna be feeling very swollen on my body and my face. And I just take a couple of pills, of water pills. It makes me feel better. But for our face, there's another way of treating it. It has to be with cold and massages. We cannot be dependent on water pills all the time. Yeah, no, it's not good for your health. Okay, so I'm gonna be starting first with your under eyes. Just put the light better. It's gonna feel cold, okay? Just so you know. Okay, you ready? Here we go. There we go. Might feel a bit oily, that is normal. Good. Now this side. Good. Start the first massage in the area. Okay. You're doing great. Yeah, it does feel good with how cold it is, right? You're doing great. I'm going to be applying cold compresses too under your eyes to accelerate the process. Oh yeah, believe me, it feels absolutely great. There we go. There we go. Now let's go with the compress. Now these ones are a bit colder than the jade stone, so please be aware of it. Just remove the excess. Okay, just be prepared that it's gonna be colder than the stone, okay? Very good. First one here, like so. And I'm gonna be using a UV light to speed up the process too. It reacts to it. Good. Excellent. If it feels uncomfortable, let me know, okay? You're good? Okay. Let's remove it. Hello there. Very well. We're gonna finish your eyes with this aloe vera syrup. Amazing for the eyes. It also helps with the bags that we tend to have here, so it just works great, some wonders in it. Oh yeah, and it helps that the aroma is amazing. I'm gonna apply it with a brush since it's easier this way. Okay, looking up for me. Good. Good. Now this side. Good. Excellent. It might feel a little bit itchy, but it shouldn't be uncomfortable, okay? Now, let's work with the rest of your face with the massage. Now, the serum is oily. It's gonna feel very, very slippery. You can see how slippery it is. Just put it all over my gloves here. There we go. There we go, excellent. Now I'm going to be applying a little bit more of pressure into the area, like so. Great. Now you see how I'm pressuring to the outside to release the water. It's puffy in our face. Now here too, this is the area where the water retention is greater. Okay, I know it can be uncomfortable with how oily the skin is, so I'm gonna be cleaning it too. Very well. Okay, how does it feel under your eyes? You didn't get any itching? Okay, just remove that, okay? Okay, I'm gonna ask you to look up for me. Up, good. Gentle stippling here. Stipple, 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 stipple. Looking up. Stipple, 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 stipple. There we go. Okay, I'm gonna add a refreshing syrup on you. Just gonna ask you to close your eyes. Yeah, cover them a little bit. Feels great, doesn't it? And this last one, again, I'm gonna close your eyes. There we go. It's a little bit damp. Let's just take it out. Now this start working the moment we start the massage early on. So in about half an hour to an hour, you're not gonna feel puffy at all. It's gonna feel just smooth and like regular. Let me just take this out. There we go. Okay, so that will be all for your treatment. Do you have any questions? Okay, well, as I was telling you, at home, when you're feeling or you look puffy in the eyes and you notice the swelling especially, what you can do is take a spoon, regular spoon, teaspoon, and put it in the fridge for about, I would say 2 minutes, or into a bowl of cold water. And what you're gonna be doing is, let's say this is a spoon, pressing it into the areas that are swollen in your face, especially the eyes, very gently, not pressing too much, just barely touching. And after a few minutes, it's gonna start going down, the swelling. Well, it was a pleasure working with you again. I don't know if we have another appointment for next week, but in any case, I'm gonna be contacting you for it. Okay. Okay, very well. Well, please take into consideration what I was telling you about your diet. And if you don't find anything unusual, please go with your doctor. Of course. Well, take care, and I will see you next week. Goodbye. Hi, how are you? I'm Jonie. I'm here to help you. You're looking for... Oh, okay. You want to remove the fuzz from your skin? Is this your first time? Oh, you have done it before? Okay, okay. What type of treatment do you use for that? Okay. So let me just prep up myself so I can check you out. You're looking just for your face? Whole face? Okay. So mustache area too, forehead. Okay, see. Okay. Actually, you can see a few parts. The sides, pretty normal. And do you want this to last for long periods of time? What is that you're looking for in terms of time for it to last on you? Okay, you don't want anything with chemicals and as natural as it can be possible. Okay, we have two services for that. We have one with thread and the other one with a blade. The blade is very small and we do some shaving on certain parts, and with the threads, actually, let me show you here. We use this tool that allows us to remove all the pitch hair in the areas, and it doesn't hurt at all. It's completely natural, doesn't have any chemicals in it. Wanna go with it? Excellent. So, you didn't like the chemical one? Yeah, for certain skin can be a bit too abrasive, so let me just your hair to the back. Now this one will last for around, I would say, 6 to 8 weeks for your fuzz to come out again. With the other services that we have for 3 months and 6 months. We have a laser one that is pretty good that maybe you want to try. Well, in terms of pain, as you were telling me, it's not painful. It does involve a slight discomfort, but it doesn't hurt. But it all depends on how your skin is, how you manage discomfort on your skin. All skins are different, so they react differently to the treatment. We could try it if you want. Maybe a little sample. Yeah, I'm going to show you. So, let's see. Let me just inspect your skin. So we're going to be focusing on these areas here. Let me just light you up a bit. Can you look to the side, please? Nice. Not to this side. Okay, it's not that much. So let's do a test out with our laser one. Let's see if you like it, okay? It's pretty light. This is what we use. So the laser will come up from here, and it's gonna be burning out the follicle, taking out the push hair there. It feels to some people like a pinch, a little slight pinch, and it feels cold to the touch. So we can do a little testing if you want. Okay. very silent, so you're not gonna hear anything. Okay, ready? We're just gonna try it in this part. Little pinch it here. Okay. Let me try something. I'm gonna apply this serum on you. Helps relax the skin. You're not wearing any makeup, creams. Good. I help you try it. Okay. This way is faster. Very good. Okay, we're going to try the same place. Here we go. How's it going? Good. Yeah, maybe it's a bit that your skin is very sensitive. It's different for any skin, so we can try first with the threading, and then in the areas that are a bit difficult to reach, we can use the tool if you want. Okay, excellent. So let's start on the bigger place, which is gonna be the sides here. Okay, ready? Did it hurt? You okay? Very good. Yeah, it pulls a little bit. Now this is great for fuzzy hair that is longer. We just tied it up a bit. Makes a little bit more of tension for you. Let's see how this one feels. Ready? Did it go good? Good. Excellent. It does work for the eyebrows, although only for the upper part. Other areas could be a little bit difficult. There we go. There's some redness present. That means that you do have sensitive skin. Every time you touch your skin, it happens quite a lot. Yeah, it depends on the skin. There we go. Let me go with a blade here. Gonna go with number 2 probably. Should be a good one. Yeah, definitely. Okay. Well, it's better to do it with dry skin than wet. Yeah, it all depends on the skin and how the hair is. If it's too coarse or too long, like a beard, yeah, you definitely need something wet and soapy. But when it's peachy hair, there is no need. You can just do it like this, and it falls very easily. Good. I'm gonna give you clearing treatment to help the healing process with the redness that you have. Some moisturizer too. Yeah, this is also very helpful for men. Let's say the beard. This is a different kind of shaving. But in other places in the face, like in this area in particular, where a lot of hair tends to grow in some people on top of your eyebrows, it's perfect for that. Yeah, for the guys. Good. Let me just clean that up. You're gonna feel your skin very soft after this. It feels great. Good. Let me just check you out with the light. If I'm missing a few parts, can you look this way, please? Very good. Looking up too. Excellent. Now this way. Very good. Okay, I'm missing a few parts. Just take off some of the hairs here and there. Okay. Let me know if it feels too uncomfortable. You're okay? Very good. Now let's try the laser tool again. I'm gonna be using it on this part right here. Okay. Any discomfort, pain? Good. That looks great. Let's try it here. I believe your skin is a little bit numb right now from the threading. It happens. Yeah, it feels more comfortable. But definitely for you, with your type of skin, you require to be on very gentle tools for this type of treatments. Okay. Just gonna finish up this part. Very good. Now this serum that I'm gonna be applying is gonna help with the redness that you're feeling, well, that you have right now, and it's gonna tend on some parts feel a little bit swollen from the pressure. Don't worry, this is gonna help with that. Okay, for you, since you have very delicate skin, I'm gonna go with this treatment. Okay, I'm gonna ask you to close your eyes, please. Yeah, it just does have a really nice aroma. Very nice. Here. Just because it's gonna feel a little bit wet, we're gonna be using the fan to help it be absorbed. And it's a leave-in serum, okay? With this, the redness and swelling is gonna go down in less than half an hour. Okay. Good. Now I'm gonna be applying some filter just to protect your skin, because right now it's a bit delicate. For you, we're gonna go with the other one, this one. Very good. So we are done. That's good. Okay, I'm gonna give you a little bit of hand sanitizer on your hands. Clean them good. Now you can touch your skin. It's gonna feel very, very soft. Right? It does feel great. Let me just take this off. Now, the aftercare. It's very important not to touch your skin with dirty hands right now or at any moment. Remember that our hands tend to have a lot of bacteria in it, so we never want to be touching our face without cleaning our hands first. And that will be all. So right now I put solar protector. It's gonna help you quite a lot, but I do recommend you to wear sun protector for at least, well, you should wear it anytime, but at least 5 days. It's gonna help you quite a lot. And that will be all. Do you have any questions? Well, it was my pleasure. Thank you so much for coming to our clinic. And in case you need or require another service, please feel free to call us. Of course, please take care. We'll see you. Bye-bye. Please make yourself comfortable. You're here today for your chemical peel. Oh, very good. So I was just waiting for you. I have everything prepared for you. Let me just first put this to get your hair to the back. This is your first ever session with chemical peel. Yeah, okay. I'm gonna explain you in a little bit in what consists of the service. I was reading your history here and your application that you're a little bit worried with acne scars. Okay, hold on. And yeah, chemical peel can help a little bit on that matter. Well, it all depends on the type of scars that you have. If they are too deep, it won't work that much. Yeah, but we're gonna check in a little bit, okay? So now, for acne scars, we have to determine what type of scars do you have. If they are very superficial, or if you have little spots, little parts of scars, it can be treated pretty easily. So let's take a look. Let me put on my gloves so I can touch your skin. Okay, no makeup at all? Excellent. Thank you so much. Yeah, because sometimes my patients can come with full face makeup and it does take a while to remove it. Now, let's see. Any area in specific that you're looking for to improve? Okay. So I see. Normally what we see the most with acne scars is in the cheek area. I myself included. I have quite a few in that area. No, unfortunately my type of skin is not a candidate for this type of treatment. That's why we do these consultations to see if your skin is a candidate for it. Yeah, because if you have a very sensitive skin like mine, it can actually damage more than you can repair. So with the chemical peel, what we're going to do is peel a layer of your skin to reveal a new and fresher layer. And with this, what we see is that it can improve scars and even freckles, or also scars that are not concerned with acne, like maybe you had an accident or a burn or something like that. It can improve quite a lot the health of your skin. Well, in your case, I see that they're very superficial. They are not too deep. I don't believe that with just one session will be enough. In your case, you might need 2 sessions, but of course, with a chemical peel, we cannot do 2 sessions in one time. So what we're going to be doing today is do the first session and after 3 weeks we can do the second one, and that is gonna give you an improvement of, I would say, 90% on your case. Now let me do a little test of your skin just to make sure that you're a candidate for this. We want to make sure that you don't have any problems with sensitivity or allergies, okay? I'm gonna be brushing your skin with this. I just want to see how your skin reacts to the touch. Sometimes when we brush skin with really hard objects like this little brush right here, it can react. Sometimes you get a little bit of rosacea, sometimes get a little bit of the bumps. That's a sign that your skin is not a candidate for this. Okay? So we're doing it in the areas that we will be applying this. Like so. And we just wait a little bit to see if your skin reacts. Also, while doing your inspection, I noticed that you have quite a bit of a skin fur, as we call it here. It's this peachy hair that is in our face that needs to be removed before the chemical peel because it can react badly to it. So we're gonna do a dermaplaning, which consists of just shaving that really tiny fuzzy hair in your skin, especially on the areas that we're gonna be applying it. We're gonna be using a tool like this one. It's a tiny plate that I will be using to brush up all those tiny hairs in your skin. Okay? Don't worry, it's completely included, okay? So, let's see. No, there is no reaction. Looks completely normal. Looks very good. So, yeah, you're the perfect candidate. Let me just prepare your peel, and then we're gonna be moving to the dermaplaning, okay? Now, the chemical peel is just a liquid that we apply to the skin. Don't worry, it sounds a little bit harsh, this chemical peel, but it doesn't hurt at all. And what will happen is that it takes around 2 days, so that's why we call you during the weekend. So by Monday your face will be completely normal, but by tomorrow your skin is gonna start peeling off. You're gonna be removing that at your home with a special soap that we're gonna give you here, and that is what consists of removing that first layer of your skin. And then after 2 weeks, as I was saying, we're gonna do the second one. You're gonna see an improvement right now of I would say a 40% of your scars. So let's prepare this. This is our main ingredient. This is what reacts into the skin, creating the peel that we desire. Yeah, it's actually gonna feel like when you have a sunburn, but without the pain, that your skin starts flaking. Exactly the same. Only that your skin is gonna look a little bit red during that time, but by the second day, it's gonna look like normal. That's why we urge our clients that if they work during the week or if they work during the weekend, take into consideration those days because you need at least 2 days rest. Well, not rest, but not be exposed to the sun. So, this. Good. Okay, well, this gets prepared. start your dermaplaning. Very good. So I'm just going to be shaving the little hairs around the areas that I'm going to be working with. Okay? As you can see, the blade is very, very tiny. And I'm just going to be shaving all those areas very slowly to get rid of that fuzzy hair. Okay? Now, we also do this service, dermaplaning full face. What it does is clean the skin of dead skin cells, the fuzzy hair, as I was saying. It's also very good for blackheads in the nose area. So if you're ever interested in a full dermaplaning, we have it available here. Yeah, actually I did have quite a lot of acne scars, but mine are a little bit deeper. But it all depends on the skin. There are so many different kinds of skin types and how it reacts. In my case, my acne reacted very, very violent to my skin, leaving really deep scars. And I tried microdermabrasion for it, but it was way too painful, extremely painful, and it didn't work. So I just gave up and embraced my scars. Sometimes it's what we have to do when there's no other options. Now you're gonna feel this area very soft now that we're doing the dermaplaning. It's one of the things, the good things that dermaplaning does here. Removing the fuzzy hair. Leaving the skin very, very soft to the touch. Now, okay. You're almost done. No, actually, the peeling process should be starting right now. Okay, by this time, it should be started in around 8 hours. In 8 hours, you're gonna start noticing your skin peeling off a little bit, but hear me out. Don't peel it out yourself, okay? Let it go. Let it go, okay? Slowly, it's gonna start peeling on its own. And by the 12 hours, you're gonna use the special soap that I'm gonna give you. And that will get rid of those peeling, leaving that new layer of skin visible. Okay, good. I think that's enough. I just wipe off the fuzzy hairs. I'm gonna do a quick wash of your face, and then I'm gonna be applying the peel, okay? Okay, I'm gonna be needing you to close your eyes, please. I'm gonna spray you with this liquid soap. Ready? 1, 2, 3. And then we're just gonna wash your face with this very gentle and soft brush. It feels really nice to the touch. I love it. And it feels good in the skin too. And don't worry if you don't remember all the information that I'm giving you right now. We're going to give you a booklet with instructions so it's easier for you to remember what to do. It's pretty easy to follow the instructions. But if you have any questions, you can always call us or email us or send in a text, okay? Okay. Good. Can you close your eyes for me? Okay. Even though I'm not going to be applying in the eye area, we want it to be completely sterile and clean, because sometimes when we're sweating or even our natural skin oils can affect the process, so we need a very clean skin for it. Now during this process, I'm gonna put a protection layer in your eyes because I don't want any of the fumes go close to your eyes. It doesn't smell bad at all, but the fumes that it gets out can be a little bit irritating for the eyes. So I don't want it to be uncomfortable for you. Okay, I'm just gonna be putting this in your eyes for a little bit just to protect them. Just gonna cover here for like this. Okay, looks good. And you're gonna be applying your peel. Now, it's very important for you to let me know if at any moment you feel a burning sensation. You shouldn't be feeling absolutely anything, okay? Not even the slightest feel of burning sensation, okay? So let me know if you feel it. I'm just gonna be touching first this area for a tiny bit. I'm gonna wait a few seconds. That's when normally the reaction starts. Okay. 5, 4, 3, 2, 1. Do you feel anything? Not at all? Excellent. So, let's start. Yeah, it actually smells like mint, isn't it? Pretty crazy. I do love the aroma. It smells good, but the films can be a little bit deceiving, and some people can actually cause irritation to the eye. That's why we put protection. And in other persons can lead to a very bad allergic reaction. Now, this is going to be set for a couple of minutes, around 5 minutes. We're going to let it in. Then we're going to remove the excess because the peeling process it's already started. The moment that this solution touches your skin, the process starts. But as I was saying, by the 8 hours when you start noticing the peeling, it's very important not to touch it, not to feel like peel it off. I know it can be difficult because it's actually quite satisfying. We're almost done. Let's do the last part. Okay. I'm gonna let it sit for 5 minutes. Now, let me tell you about the soap. It's a liquid soap, okay? This is what you're gonna be taking home. What you're gonna be doing with this is, first of all, your face is gonna start peeling off. You're gonna notice that there are some places that is peeling quite a lot, but contain the urge to peel it off with your fingers, please. What you're gonna be doing is, with the soap, first of all, you're gonna be in your bathroom. You're gonna put a towel around your head so no hairs get into your face. Now, with clean hands, you're gonna be getting a little bit of soap. I'm sorry. I'm missing a very important step. You're gonna be using a hand towel first with warm water. Okay? You're gonna soak it in warm water. You're gonna be applying it directly into your skin without scrubbing, like this. Gentle patting your skin so it gets a little bit humid, wet, and moist. When you feel that is enough moist in your skin, then you're gonna get your liquid soap, put it in your hand a little bit. You need a lot. Then you're gonna start rubbing it until it gets a really nice foam. Once the foam is really fluffy, you're gonna be applying it directly into the areas where the peeling started with gentle circular movement like this. You're gonna start scrubbing your face, very gentle, for around a minute. Then, as I was saying, all the instructions will be in the booklet. Then you're gonna get your towel again and pat your skin again to remove that soap. And then you're gonna repeat the process for about, let's say, 5 times, or whenever you start seeing that the peels start flaking out. This is by the 12 hours, okay? That's when the process of peeling should be ready and final. After you have removed all your peels, you're gonna tap your face, with a clean towel, dry. Again, very gently patting your skin, like so. And you're gonna leave it. You're gonna notice that your skin, it's red, a little bit red in the areas. That is completely normal. By the next day, your face should be looking like normal. If you notice that there's a little bit of peeling still left, you're gonna do the process again with the soap, because the soap, it has the agent that removes that peel of skin. But don't worry, if you have any questions, you can always call us or send us an email. Okay, let me just remove the excess now. Good. Now, did you bring that umbrella that I was asking you about? Okay, this is because I don't want you to have any sun exposure. Okay. Now, let me just remove the eye covers here. Quite sticky, and the hair cover too. Now, one important thing is, since we ask you to have 2 days off of whatever you are going to be doing, try not to touch your face during that time of the peeling, okay? It's very important for the process to be left alone. Also, have your hair all the way to the back in a ponytail if you can. Now, do you have any questions? Yeah, are you okay? Okay, so now in the booklet that I'm gonna give you is all the information illustrated with pictures, so it's easier for you. And it's the same as I was telling you about right now. Now here is your soap. You're gonna be needing it. In any case, if you notice that your skin starts peeling, the peeling process is painful. It shouldn't be painful at all, not even the slightest discomfort. If you notice that this happened, please call us immediately here in our car. You can see an emergency number. You can call us and we will help you, okay? This doesn't happen. In all my years working here, it has never happened. But if in any case it happens, let us know immediately. You shouldn't be feeling any pain or discomfort, okay? Well, that's it for me. If you have any other questions, well, it was a pleasure. So I'm gonna book you for in 2 weeks, okay? 2 weeks time. Let me just put this in the agenda. Now during this time, so I was saying, you're gonna notice like a 40% improvement on your scars, and in the next one you're gonna notice almost 100% in your case, in your particular case, because your acne scars, as I was saying, they are not too deep. Okay, so you're set up. We're gonna be calling you a few days before your appointment to remind you. Okay, well, it was a complete pleasure. Please take care and remember to use your umbrella. Thank you. Goodbye.